At the heart of regenerative medicine lies a fundamental biological question. Can we restore cellular energy in damaged tissue? If mitochondrial function can be reactivated, the intrinsic capacity for tissue repair may follow. Several years ago, Dr. Patrick Treacy initiated exploratory work combining red light photobiomodulation with platelet-rich plasma and stem cell-based approaches in the management of burn injuries and tissue ischemia following vascular occlusion. The aim was to enhance mitochondrial activity, improve local perfusion, and support regenerative processes in compromised tissue. At the cellular level, mitochondria function as the primary engines of bioenergetics. Within the mitochondrial matrix, metabolic substrates enter the Krebs cycle, generating NADH and FADH2. These molecules donate electrons to the electron transport chain, driving oxidative phosphorylation and the production of ATP. A key regulatory component within this system is nitric oxide, a small gaseous signaling molecule capable of reversibly binding to cytochrome C oxidase, or complex VSA. When nitric oxide occupies this catalytic site, mitochondrial respiration may be transiently inhibited, reducing oxygen utilization and limiting ATP synthesis. Photobiomodulation, using red and near-infrared wavelengths, appears to interact directly with this mechanism. Photon absorption by cytochrome C oxidase facilitates the photodissociation of nitric oxide, restoring electron transport, improving mitochondrial respiration, and increasing cellular ATP production. As oxidative phosphorylation resumes, NADH is reoxidized to NAD+, allowing continued metabolic flux through the Krebs cycle. The downstream effects include enhanced mitochondrial efficiency, improved nitric oxide-mediated microcirculation, and activation of pathways associated with tissue repair and regenerative signaling. These findings highlight a central principle of regenerative medicine. Restoring mitochondrial bioenergetics may help restore the intrinsic capacity of tissues to repair and regenerate.